Hello everyone, my name is Rama Anapareddy. I'm one of the principal trainer from Lumio Regional Training Team. Today I'm going to demonstrate how to add or modify an allergy for by a pharmacist and pharmacy technician. So for this, you are going to go into your app bar and sign into app bar. I'm just going to use my credentials. So when you sign in, this is a one-time process. So I have these many accesses. I'm just gonna go and sign in as a pharmacist here and select, and it will open up the app bar, and you will see for this demonstration or for this purpose, you'll use the Med Manager to add or modify a patient anything in a patient's profile. You will use the Med Manager. So I'm just gonna go ahead and open the Med Manager, and it just have to work its magic and open up. So when you open up the Med Manager, Pharmacy Medication Manager window, you will go into a clinical summary page of the patient. So for this, like there is no patient at this time, we're gonna go and search for a patient. In Med Manager, you can search a patient by patient's name, health card number, MRN number, or financial institution number. So for this demo purpose, I'm going to use a patient ZZZ Rama 1 and hit enter. So as there is only one patient with name ZZZ Rama, the patients directly open up. But usually, if they have like a multiple encounters, you need to choose the right encounter. So when you open the patient, you will see the patient's acute profile, which includes the demographic. There is nothing recorded on this patient because it's for the demo purpose. So, and allergies and the clinical notes by pharmacist and the pharmacist interventions. So for this demo, we're going to concentrate on the allergy summary area. So to add an allergy, I'm just going to show you how to add an allergy by free text and also coded. Coded allergies are the ones that are already exist in the system, that you can pick by their code, but the free text are not, they're not in the system, so you have to add them manually. So for this, when we open up the allergy plus symbol here, you open up the plus symbol, it will take you to the allergy area profile for this patient. You already see some of the allergies that are already been added for this patient. I have been the nurse usually does them. Usually do add the patient's allergies when they do a patient's history. So now I'm just gonna UC amoxicillin allergy, shellfish, and unable to obtain or document. So first now I'm just gonna go ahead and show you how to add an allergy. So to add an allergy, you're gonna hit on add symbol here, and for this purpose, I'm gonna, so when you hit the add button, you will open up an allergy, add an allergy or modify an allergy, or anything you can do in this screen. So I'm just going to take a minute to explain you what we are doing here. So this is a type of allergy which is like a intolerance or side effect, or it's an allergy. The substance, like we're going to search for the substance which the patient is allergic to. We're going to look up there. This is a severity. The asterisk symbols are like the ones where we need to add them for sure. So the severity, mild, moderate, severe, or unknown. So, and the category, is it a drug, is it an environmental, or a food? Um, as a pharmacist, we're going to main concentrate on the drug allergies, right? So, and we also can add a comment for the drug or the patient. When we do a patient interview, we can get as much as information we get, and we can add a comment as the patient advises. So for this, I'm just gonna add an side effect of a drug. Let's see, let's search for cephalexin. I'm gonna cephalexin, I'm gonna put the words, the first two letters or three letters, and hit enter. Or you can actually hit on the binoculars symbol here. So it will open up the substance search dialog box. So you will see a cephalexin here, and then you see a code for this. This is what I meant, the coded allergy. So I'm just gonna click our cephalexin and hit OK. Now your substance area is filled up. Now we're gonna hit a try and search for a reaction. What does the patient have, like if he takes the cephalexin? So we can search for a reaction here. For this, I'm just gonna search for a rash. So let's hit rash and click enter, or you can also use this binoculars. I'm going to click on the binoculars, and you see a coded rash here. You can pick any of them and hit OK. You will see the rash comes up in the response indicator box here. And then we're going to look for severity. We will just say it's a mild, and the drug category as it's a drug category. We pick a drug category, and we can hit OK. So now you see in the ADR profile, you will see a cephalexin allergies has been added. This is a cephalexin side effect. It's a drug and mild, and it has rash. So now I'm just going to show you how to modify an allergy. So to modify any of the allergies that already been entered, you will go and hit click on the drug that you want to modify. So for this purpose, I'm going to click on amoxicillin and hit modify. It opens up the modify pane. It exactly looks as how when you're adding a drug. So in this, like for this amoxicillin, we already see a rash. It's drug. It's a moderate. I just want to say it's not an allergy because it's a side effect. I can just go and change from the drop down in the type. I'm just gonna save it to hit to side effect. So I just also want to take a minute to mention you about the status. So is it an active or if it's a resolved, or it's a proposed, or you can cancel because it's not anymore. So you can do any of these ones from the status drop down. So for now, I'm just going to hit active. Let's say if we want to add a comment or anything, so we can hit add comment. The comment box opens up. We can say patient states he gets rash with MX. You can hit OK and then hit OK. Now you see the type has been changed, and also there is a paperclip here that which mentions it's in a, there is a comment for this allergy. Okay, that's how you do a coded allergy and how to modify. So now I'm going to go ahead and show you how to do an free text allergy. For this, you go add, and you can hit the type. Let's say it's a side effect. For this demo purpose, I'm gonna use xylitol. Xylitol and hit enter, or the binoculars. I'm gonna hit binoculars, and when you search, there is in the substance search bar, you don't see anything that's come up here because it's not recorded. So I'm just gonna hit cancel, and then I'm gonna check the free text option here. So when you hit a free text option, it will show that the interaction checking is not possible with other drugs because it's a free text. Okay, I'm gonna hit OK, and then for the reaction, you can actually do a coded. I'm just gonna search for diarrhea and hit enter, and you will see a coded diarrhea side effect that comes up. So I'm just gonna hit OK. And I also want to add another reaction. So we can do a free text response indicator like a big toe swelling, and we can hit search and there's nothing comes up, so I'm just going to hit cancel and add as a free text. So you see the difference, like when you do a coded allergy and a free text allergy, the indicator, the free text response indicator will be like there will be a lock, the key symbol here for the coded, and there is a pen, a hand holding a pen, something. So now we can search for, we will say moderate, and we will say drug, or whatever the category is. Like you can also, like when you're doing your, like when you're doing the patient interview, and like you find out, you can actually hit dates and everything. You can, the info source, like where do you got the info source from, we will say patient. Like you can just actually play around and see where you, and you can also add a comment. uh, Patient has big toe swelling when he consumed xylitol, which is new. Just gonna hit OK, and you can hit OK. So you will see there is a xylitol allergy that has been added, and you will see a comment. That's the paperclip, and you'll see the comment here. That's how you add, modify, and add a coded allergy and free text allergy. Now I'm just going to take a minute and talk about unable to document or obtain allergies. So when a patient records an unable to document or obtain allergies, when you actually open a patient's chart in our Med Manager, it should give you a ticker or a dialog box which says that the someone has documented as a unable to obtain or a document allergy. So it's the pharmacist's responsibility to complete the drug allergy session in the patient's chart. So it will, until you actually complete this, the unable to obtain or document and actually note allergies in the patient's chart, this pop-up will always open up, like the pop-up that says this, the patient has documented as unable to obtain or document allergies. So pharmacist team, when the patient opens up the chart, like it will show at the first, and also every 4 hours it will ticker until you actually complete this. So for this demonstration, I added this unable to obtain, and now actually you talk to the patient and you got some of the allergies that you already noted. So we can go and click the status as cancelled or resolved, however you want. So you can cancel. The reason is um, you can click anything, like a patient request, physician request, or what, wrong information. I'm going to click wrong information because we already got this. So you can hit OK. And the red a strike off line will come on this. And we can close this, and you will see all the documented allergies that we just did will pop up on the patient's acute profile. And also I want to mention that the only the pharmacist or the pharmacy technician has the access to add and free text allergies. So that is all how to add an allergy, modify, cancel for a patient, patient's allergies. I hope it is helpful. Thank you so much.